Hello, my name's Scott, and this is the next lecture in the Transgender Health series, a series of 8 lectures to increase transgender health literacy at UVA. Um, this lecture focuses on social determinants of health and how they relate to the transgender patient. This is a quote from the World Professional Association for Transgender Health, stating that being transgender a pathologic diagnosis increases stigma and decreases health outcomes due to marginalization and exclusion. In order to understand the social determinants of health, you first need to understand some of the legal protections for transgender persons. Many LGBT plus advocates pushed for legalization of gay marriage, which it was accomplished in the United States in 2015 due to the Obergefell v. Hodges decision by the Supreme Court. But many critics of this state that efforts should be more focused on non-discrimination in housing and employment. At the national level, there's still no protections for housing and employment. However, the Equality Act would extend these non-discrimination rights to people of sexual and gender minorities. Many states have passed laws preventing this type of discrimination. However, in Virginia, discrimination is only prohibited at the state level for public employment. You also need to understand the bathroom bills, which are legislation which could be inclusive or exclusive, but in recent years has gained a lot of media attention for being these exclusive laws preventing people from using the restrooms of their gender identity, rather focusing on forcing people to use the bathroom that aligns with their sex assigned at birth. There have been 3 attempts in Virginia to pass bathroom bills, which would exclude transgender individuals from using the bathroom of their identified gender, but all failed to make it past subcommittee. The use of unisex bathrooms is a way to provide a safe space for trans people to use the restroom without fear of discrimination. Here in Virginia, the Human Rights Campaign posts this Municipality Equality Index, which you can find a link in the bottom left here, which looks at the different cities, major cities in every single state, and gives a score for how well they take care of LGBTQ people. Here in Charlottesville, we do very well on the MEI with a score of 85 out of 100. With our non-discrimination laws at the municipal level protecting employment, housing, and public accommodations. However, we don't have any of these protections at the state or county level. Many of our patients, especially those coming from Southwest Virginia, such as Roanoke, have a lot lower MEI score, which indicates that there are fewer protections for LGBTQ people. Also here you can see a bathroom map, which is published by the UVA LGBT Plus Center here, which shows the unisex bathrooms for transgender persons to use without discrimination. The Virginia Values Act was recently passed by the Virginia House and Senate and needs to make it past a few more committees before being signed by the governor. But it looks right now that this act is going to pass, which would extend protections for minority classes based on both gender identity and sexual orientation. This is a huge bit of legislation to protect in both housing and employment for LGBT plus persons. The minority stress model has been found to apply to people of racial, ethnic, and sexual orientation minorities to provide an explanation why they have poor health outcomes. Basically, the minority status causes general stressors in the environment, and then how they can cope in their social support mitigates negative mental health outcomes due to their minority status. An online survey of transgender persons in the United States found that the minority stress model also applies to transgender people. And a lot of poor health outcomes can be directly related to stresses caused by the environment. This is just a chart showing how much stigma and abuse and harassment transgender people in the 2003 internet sample experienced, with the majority experiencing verbal abuse, with a significant minority experiencing sexual abuse, denied housing, being arrested, problems with getting HIV and substance abuse treatment, and even being physically abused. This was a study showing lifetime risk of suicide amongst transgender people based on multiple different characteristics and experiences. The lifetime risk of suicide for transgender people was around 40%. Um, this is attempted suicide, not completed. With the highest rates of attempting suicide being related with a doctor or other provider refusing care because they are transgender or gender nonconforming, with 60% of those transgender people having attempted suicide in their lifetime. This is a quote by one of my friends who is a transgender male who agreed to sit down with me for an interview. The results of that interview can be seen in an adjunct document. But this quote is just, overall, I am disheartened by my medical experience, and I don't go to the doctor expecting to be respected this anymore. This is a study by Johns Hopkins which showed state by state, as same-sex marriage was legalized, the rates of suicide amongst all students and students identifying as sexual minorities. There is found to be a 4% absolute risk reduction amongst students identifying as sexual minorities after legalization of same-sex marriage in their state, which gave a number needed to treat of 1 in 25 people less likely to attempt suicide in the past year after legalization of same-sex marriage. This emphasizes the minority stress model, and that relieving minority stress is a way to treat underlying comorbid anxiety, depression, and suicidal ideation. Access to housing is a huge issue amongst LGBT plus persons and is a major social determinant of health. Up to 40% of LGBT people are homeless, with the majority being homeless due to being forced out or having to run away from home, a lot due to family issues or even physical abuse at home. This is compared to 7% of the general population, which is homeless. Lastly, I want to touch on intersectionality. While I've mostly talked about gender identity and sexual orientation, race, nationality, and disability all play a role in minority stress, with people who are both gender and racial minorities experiencing the highest rates of depression, anxiety, suicide, and poor health outcomes. Transgender women of color are the most likely people to experience harassment, to be murdered, and to have anxiety, depression, and poor access to health care. It's important to be cognizant of racial, disability, nationality, gender identity, and sexual orientation when treating your patients in order to make sure that they feel comfortable seeking health care.